Hello everyone and welcome back to Clinical Cousins YouTube channel. Today we're going to be going over the premature atrial contraction and a rhythm called ectopic atrial tachycardia. So first we're going to go over the premature atrial contraction. So a PAC is it's exactly what it sounds like. There is an early atrial contraction that messes up or makes our rhythm irregular. So what is the cause of this? So we know that our SA node is right here. The cause of a premature atrial contraction is that there is another set of pacemaker cells that fires a command which results in a new complex. So if the SA node is usually the only captain at the top of our ship, then the PAC is caused by another captain in the atria who's trying to give an order. So the rate will vary for this rhythm, and we know that the rhythm is going to be irregular because of that extra unpredictable premature atrial contraction. The P waves are still present. The PR interval is the same, 0.12 to 0.20 seconds. There's one P wave for every QRS because we are starting in the atria. So you know if the atria depolarizes, it's going to be a P wave. The QRS duration is still the same. It's 0.06 to 0.11 seconds. There's occasional grouping of PACs. If this were to fire in succession, you could have a few premature atrial contractions, but there are no dropped complexes. So we need to remember that a PAC is a premature atrial contraction that is caused by the firing of another pacemaker or captain beside the SA node. So after the premature atrial contraction, what basically happens is the SA node is reset, and then the rhythm will keep on firing due to the command of an SA node until another premature atrial contraction occurs. So now we're going to take a look at a rhythm called ectopic atrial tachycardia, or I like to call it EAT, and it is basically just a quick spurt or a quick segment of tachycardia in what would otherwise be a normal sinus rhythm. So this is due to the fact that there is an atrial pacemaker commander that all of a sudden he calls out a bunch of orders very quickly and then goes back to sleep. So we know this is called ectopic atrial tachycardia. The rate is between 100 and 180. It is irregular or unpredictable due to the fact that we don't know when this random spurt of tachycardia or this random burst of orders is going to show up on our EKG. So that's why we say it's irregular or unpredictable. But however, it's starting in the atria, so we know that there's going to be P waves present. We know that the PR interval is going to be the same, 0.12 to 0.20 seconds. There's going to be a P for every QRS complex. Again, we're starting in the atria. There's going to be a P. The QRS is still between 0.06 and 0.11 seconds. There's usually no grouping and no drops. But to review, what we need to know about PACs is that they are due to the random firing of another pacemaker besides the SA node. So the SA node will be going, and all of a sudden you have a random fire, and that's the PAC. And then for EAT, there's a group of pacemaker cells that fires a short burst of quick impulses, which shows up as a short burst of tachycardia in what would otherwise be just a normal sinus rhythm. So as always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.